Here.
Beston and Petto are excused. Lane, Miller,
Present.
Weaver,
Here.
Collins,
Here.
and Lockhart. Here. You have a quorum.
Thank you, Rebecca, and welcome, Mr. Weaver, our first Health Committee meeting. Welcome aboard. Glad to have you.
Got a heavy agenda for the first meeting.
I know.
That's why he had to get me here, so we can.
It's gonna take all
Get
night.
it over with.
All right, can we get a motion to, under previous business, get a motion to approve the previous meeting minutes? Mr. Miller, second by Ms. McLaughlin, all in favor? Any opposed? The first and only thing on the agenda tonight under current business is the Department of Health. Under number 2, amending the 2026 Department of Health budget, the public health nurse. Good evening, Commissioner Everett. Mr. Ransom Moore, how are you?
Good evening, everybody. Thank you for having us tonight. We are requesting authorization to create a new public health nurse position. This will be replacing a registered nurse position that we currently have. In addition, part of this request is to reduce a 21-hour part-time RN position and an HIV RN position that is also part-time in order to create the public health nurse position. The reason that we want to make this request is that public health nurses have a more comprehensive training and a broader skill set that supports community health, which will better serve our strategy and Albany County population when it comes to public health. Specifically, they can provide not only direct patient care, which is what an RN can do, but in addition, they can also work in diverse public health settings, including conducting community assessments, advocating and collaborating with community members. We have several initiatives that this will support, including doing public health detailing with our physician population. So I'm happy to take any questions.
Thank you, Commissioner. Do we have any questions from the committee?
Quick one, I'm assuming the positions you're eliminating are not filled, they're empty positions.
Correct. Right, so as we are looking to fill it, we identified that this would be a better use of that role because they can not only do that job, but also then do the other things.
Just the ones that, come in, I just want to make sure we're including.
Yep.
Taking a person out.
Yep.
Thanks, Mr. Miller. Ms. McLaughlin?
So, thank you for being here, it's nice to meet you. So this individual would be sort of like a, I don't know, a roving kind of person? Would they
So-
be able to do that? They wouldn't just be in the department, but you would be able to use them around the county?
Right, so they would be working in community settings to help address the various public health needs that we have. A nursing position would only do direct patient care. So this individual could do that direct patient care in our clinic, but can then also do the community work that our public health nurses do.
What kind, do you anticipate recruitment being a challenge or no?
It historically has been a challenge. However, we've been able to fill our public health nurse positions very well this year after we had an increase in salary. And so we've had a great team of individuals come on and they're getting on board and have hit the ground running. So are building a great team that we don't anticipate it will be a challenge.
So it's 2 versus 1. 2 positions that are being eliminated for this one?
Nope, so the one position is going to be eliminated, the full-time RN, to make this public health nurse position. But because of the salary difference, we're also looking at optimizing those other 2 positions to reduce the part-time. We don't need the 21 hours and the part-time that we currently have them allocated for, so we're going to reduce them down to what we are using in order to make up that difference.
Thank you.
Thanks, Ms. McLaughlin. Do we have any other questions from the committee? Ms. Lockhart?
Thank you, nice to meet you. Dr. G. Arnaro has, excuse my voice, was here and talked about a public nurse also. Is this the same kind of, is your public nurse going to be working with his programs?
Potentially.
It sounded like there was a
Yeah,
lot
so
of
his
collaboration.
public nurses will be doing something slightly different in the mental health space and dedicated to that work. Very similar, ours will be out in the community doing work. In particular, we're looking to work with our provider communities to do public
Okay.
health detailing. So it's very similar and they may have a chance to interact on those specific topics around mental health and substance use disorder.
Good.
But
Okay,
they're
good.
distinct.
So there's always some collaboration.
There's always collaboration between our 2 departments, yeah.
Thank you.
Sure. Any other questions from the committee?
What is the, is there a difference in education for the RM that's being removed with the public health?
Yes, so they have additional qualifications beyond just the RN position in community-based care.
They can prescribe, right?
They do not
Oh.
prescribe, right, that would be a licensed provider, nurse practitioner provider.
Give me some other things that they're able to do.
So their training in their nursing training, they have done community assessments. They have worked in more community-based settings, so they have had that experience, which gives them that added qualification. As opposed to an RN, there's different RN training programs, and so the ones for the public health nurse have done that community work in their training program.
And when you say community work, they have to go into homes?
Yeah, so it's doing assessments in the home, so that is where like our home visiting programs come in. So some of our public health nurses are going into the home, working with different clients to do assessments in the home, evaluating newborn babies and mom's health, looking at asthma, various things like that.
And the existing RN person can't do that?
Correct. It's that additional experience in doing that community-based work.
So there's more of a demand, there's a need for this more than?
Yes, from a public health perspective, it's much more aligned with our strategy and the needs that we have for the department.
Thanks. Oh, I'm sorry.
All set, Mr. Weaver?
Yes.
Ms. McLaughlin?
Yes, I just wanted to follow up on what Legislator Lockhart asked about mental health perspective. I just came back from NACO, the National Association of Counties, and there was a lot of discussion about mental health issues and legislation that's being put forward to the federal government regarding mental health. And I was wondering, I would encourage you to go and look at some of that, because there may be some grants that are available to support maybe even a position such as this that has that aspect attached to it. But even if it's not just this one specifically, other opportunities that the health department may have in that area. Because it talked about it in relationship to veterans, and just in general, the general population. But there's a lot of legislation that is being put forward, and if I can, I do have a copy, I'll make sure that I can get it referred to you, that talked about the specific legislation that they're proposing in the upcoming session.
Yeah, that would be great, and Dr. Giordano and I work very closely. Mental health is part of our community health improvement plan that we are putting together with him, so we'll continue to work closely and look at all those opportunities. So, thank you.
Thank you.
Thank you. Do you have any other questions from the committee? Ms. Miller? Any other questions? Hearing none, we have a motion from Mr. Miller. Do we have a second? From Mr. Collins, all in favor?
Aye.
Any opposed? Unanimous. Thank you, Commissioner.
Thank you.
Mr. Moore?
Good night.
Finally, do we have a motion to adjourn? Mr. Miller, second by Mr. Weaver, all in favor? Approved. Thank you.
Is there another committee?
Yeah.